Hi, good evening everybody. I have been asked to record this presentation by some people in the community who are particularly concerned about what's actually happening with the Pathfinder process. This is a process that has been put in place. A document was written by a chap called Alistair Campbell in the Department of Health, who's the Director of Hospital Reform. And it was signed off and co-produced by Dr. Anne Kilgallen, who is the CEO of the Western Trust. The presentation talks about our experience of Pathfinder, and when I say our, I'm speaking as the person who, my community here in the Letterbreen and Mullockdon area, way out in the west of Fermanagh, asked me to put myself forward to become an EB, which you'll see experts by experience here come up. And that meant that I was supposed to represent the entire of the west and the south of Fermanagh, which in terms of healthcare in the whole of the United Kingdom is probably one of the most vulnerable areas, certainly the most vulnerable area in Northern Ireland. And you'll hopefully understand a little bit more about that as we go through the presentation. Right, let's have a look at some of these slides. The first slide talks about particularly the experts by experience and their role, and also with regard to the staff as well. The Bengoa report, which was commissioned by the Department of Health in Northern Ireland to review provision of health provision across Northern Ireland, particularly talked about this idea of co-production. And it's quite important because normally in Northern Ireland and in the Western Trust we have something called involving and informing, and educating people like that, and that's really a doing to. And then you have another level of doing for. But co-producing is actually right up here and doing with people. And that's actually a really healthy way of managing and working and developing services. And it's going to bring the best possible outcome. So it's quite important to understand that things were supposed to really change. Bengoa was supposed to really change the way that the Western Trust and the Department of Health interacted with communities, and the way that decisions were made about our health provision. The community, this was our experience. We went to several expert by experience meetings, and we went to a big sort of promotional event at the Western Health Trust had at the Ardone Theatre. The experts by experience, I had personally asked many times from the beginning of March for the truth about the process, and I'd asked for the terms of reference and all of these things, and all of this was actually withheld from us until the 8th of May. On the 8th of May we were given the final version of an agreement that they wanted us to sign, and at the same time we were finally given this something called the PID document. And on that day they said to us, sign this by 5 o'clock or you're out. And that meant that nobody at that meeting had a chance to read the final version of the agreement, because there had been quite changes made to that, and they had no chance to read what was called the PID, which is a project initiation document, which is effectively the terms of reference and the truth about Pathfinder, before they signed on the 8th of May. So it means also that people who did sign hadn't read that. So it said in that document things about keeping patient confidentiality or things like that, things that we wouldn't normally be exposed to anyway as part of this process, and we shouldn't be, but that's acceptable. But it had something in that, it had lines saying the information shared with the experts by experience as part of their Pathfinder role should be treated as confidential and not shared. Now that's very difficult, because they are officially, and the advertisement said and everything, that we were to represent our community, and we were representing our community about their community health and their community health provision, and what was going to happen about that. So openness and transparency and the truth was also something that Bengoa and Health and Wellbeing 26 were very much at the fore. So there was an effort by Bengoa to change the culture here. It didn't seem to filter through into the experts of experience role. They said it should be kept confidential for 12 months, and then if you broke your code of conduct or you breached it in any way, it would be taken seriously and your role would be terminated by an expert by experience, as an expert by experience representing the community. So basically, there was nothing you could do. You effectively were becoming like a member of staff for the Western Trust, and I really felt that wasn't appropriate. I actually had a phone call from the Law Centre in the middle of that session, and they advised me that it was completely unreasonable to expect people to sign documents that they hadn't read, and I shouldn't sign it. So they emailed me within half an hour of me leaving and said that that was the end of my role as expert by experience. Which was good enough for me, because if I couldn't, I was being made to choose between the community that I was asking to represent about their healthcare and the Western Trust. So my side was on the community. So that was the experts by experience role. Another point about that was that they didn't listen to any of the things that I put forward in the sessions that I did attend. There were particular things that were mentioned by Dr. Bradley, very serious issues that will come up, you'll soon see that. I'd asked, made particular requests about that, and actually flagged up risks as well about some of the content of that and how that was going to be managed, and all of that and other requests were ignored. So, a little piece now about our current situation in Fermanagh. This map here, I don't know if you can pick it up from where you're watching at the moment. Light green, access under 30 minutes. You're up around the Royal Victoria here and Galvin. Coming into yellow, 45 to 60 minutes. Orange, 60 to 75 minutes. And red, 75 to 90 minutes. And the interesting thing about that map is that it's done in a way as if Fermanagh is not actually even part of Northern Ireland. This is actually a map that was used in review of health services here in Northern Ireland. But they didn't actually cover all of Fermanagh red because it would have stood out too much. But the reality is, of course, as we all know, Fermanagh, and particularly down in West Fermanagh, that we are really very remote from lots of hospital services. Now, we're remote and we're paying for it as well. This area has the lowest wages in Northern Ireland, and the people here work the longest hours in Northern Ireland for those lowest wages. We have the worst public transport links, the highest level of unfit housing in all of Northern Ireland, and we are the worst area for access to health services, and especially in regard to GPs. We should have twice as many GPs as we have already. There's an extreme shortage in waiting list, wait lists for GP appointments and things like that are a reality here. With the highest percentage of over 65s with income below the poverty matrix, so that's an obviously an obvious need. And it's a massive and increasing inequality for the 60,000 people living in Fermanagh and of course the surrounding areas, and the Southwest Acute Hospital that's the subject of this serves an area of 116,000. That inequality, due to the maximum travel times in Northern Ireland, in reality means the suffering for the community here, the most pain and suffering when somebody's ill, both physically and mentally. When there is a crisis and an illness like that, having to do those long journeys when somebody's very unwell, in a lot of pain, is really hardship. And it's costing the most time, costs and financial losses. And what's that about? It's like, a lot of people here, because of the rurality of the area, have to maintain 2 cars. So that's an added expense. But also that the time that they have to take off work to travel, and the time that they have to maybe take children out of school, and if they've got relatives and people like that, having to go with them to drive them back from an appointment. There's a lot of time lost, and the cost of that travel as well. So for many with chronic or serious illnesses, like cancer for example, that's a huge burden on that family, and it's very important that we count that we quantify and qualify that at some stage to show the reality of the community here, because it will show a massive and increasing inequality. Now, those impacts are cumulative. You know, if I had something that I could stack, ideally I would be able to show you the cumulative impact on the community here. Because, you know, we need to add those on top of a very rural community, but also very rurally isolated and, you know, bordering, you know, right up against the border of the other counties, and have no clue whatsoever about what's actually going to be the impact of Brexit, you know, at the time of recording here. A deeply divided community and segregated, very deeply segregated post-conflict society. The transgenerational trauma continues. We have very high rates of post-traumatic stress disorder, a dependency on prescription drugs, alcohol, drugs, and high rates of mental health issues. And we have, obviously, Northern Ireland, as you know, on the whole, has got the longest waiting lists in the UK now. Sometimes people going into a year or 2 year waits, you know, where you know, that's not happening in other areas of the UK. So all of these issues are endured in an isolated region, and you know, so that's very important to keep that in mind as you go forward to understand what's actually happening with Pathfinder. Now, from this bit, I'm going to go straight into the next part is the film that was taken from the invitation-only event at the Ardoan Theatre. You know, when Pathfinder was put into existence and that project budget came down, one of the first things that they decided to do was to hire PR or communications people. And you know, this event in the Ardoan was held, very few people at it, mostly and by far mostly empty seats at the event. They hired a screen the size of a house, big production companies and everything, a lot of money spent for their health conference. Everybody going down to the Killyhevlin to have a 5-star hotel luxury dinner for everybody the night before this event. And this is a trust that's 24 million in debt, spending heavily on PR and those kind of things, which is a concern. But it was mostly, what was concerning about that is that they showed very important health data about you, if you're watching this from Omagh, about you and your community. And I really felt that data really belongs to the community, and that, you know, there was taxpayers' money that was actually paying for this event, but it was invitation only. So what I did was I actually got out my mobile phone and I recorded little clips from inside that event, and I want to make sure that I share them with you now, because it's very, very important that you know and understand the truth and the reality of the situation here. It was actually said in Bengoa, and there was quite a lot of positive things in Bengoa, some that were vague, and unfortunately when things are vague it can be open to interpretation and manipulation by somebody who maybe has an agenda, you know, to be exploited in that way. But you know, both Bengoa Health and Wellbeing and the official PID document actually said it was very important to tell people the truth about that. But I'm going to move now to what the Pathfinder meetings that were held all over the county in Fermanagh, what they did not tell you.
Group of housing is often in the elderly population. So when you're thinking about repatriating patients to their homes to live well in the community, often they have a burden of domestic disrepair, and that affects the elderly population disproportionately. But 25 out of 29 of the super output areas, these are areas of 2,500, are ranked in the lowest quintile for access to services. 81% of our population live in super output areas which are below the Northern Ireland median for access to services.
In year 8, so a quarter of the children are overweight by the time they start school, and a third of them are overweight by the time they start secondary school. I want to highlight this as one of the key findings. When you look at the life expectancy across the UK, since about 2011, there's been a plateau in the gains that we'd seen year on year for a generation. In 2011, it went flat, and in deprived areas of the UK, it started falling among women. And Fermanagh and Omagh is seeing that, and actually slightly more dramatically than in other parts of Northern Ireland. So the life expectancy for women in deprived areas, and this is girls being born now, has dropped from 83 to 79 in the last 4 years. So they're losing a year of life per year at the current rate. And this is one of those areas where Fermanagh and Omagh looks average, but then when you start to look deeper, things are a little bit different. So for alcohol, admissions to hospital for causes that are associated with alcohol, Fermanagh and Omagh as a whole has a slightly lower rate, but Omagh has a rate that's nearly double the rest of the county. For admissions to hospital because of drug-associated conditions, again, Fermanagh and Omagh has a slightly low rate, but Enniskillen and Omagh appear to be having a more urban picture of reasons for admission. People mentioned mental health. This area has the lowest prescription rate for depression and anxiety, but we've talked a lot about access to GP services and whether this reflects the true mental health of the area or whether it reflects to some degree the access to GP services. It requires a bit more of a look. The suicide rate in Fermanagh, the suicide rate in Fermanagh and Omagh is the same as the average for Northern Ireland, 16 per 100,000. But in Enniskillen, for at least the last few years, that has been double the average. And about 1 in 100 people in the area is on the GP register for having a serious mental illness like schizophrenia or bipolar disorder, which is at the higher end of the distribution in Northern Ireland as well. If you took a superficial look at the incidence of cancer and the number of people who die from cancer in Fermanagh and Omagh, you would think that it was average. But when you start to look into the more deprived areas again, we see that there's a much higher rate. And the most concerning part of that is in the most deprived parts, cancer incidence is up 20% over the last 5 years, and lung cancer incidence is up by 60%. And in that, we might see some of the reasons why female life expectancy has started to fall in those communities. And the rate of cancer deaths has increased by 30% in the last 5 years in people aged less than 75 years. So moving on through the life course, there are about 1,000 people with dementia in Fermanagh and Omagh, which is the second highest rate in Northern Ireland. At the moment, there are about 4,000 people aged 80 years or over, and in about 10 years' time, that number will have nearly doubled. And people are living longer, and so the population pyramid that used to exist as a triangle now looks more like a house. It goes straight up, and every year, most people survive and move on into the next age bracket. So not only are the people in the more extreme old age surviving, but very soon there'll be an awful lot more people over 65 as well, and fewer people in the working age population to look after them. So you saw this map earlier on showing the distribution of the GP practices, and one of the GPs who was here earlier today, still is here, asked me this question at one of our events, how many GPs are there per head of population in Fermanagh and Omagh? And we don't know how many of these people are full-time or part-time, but the ratio of GPs to population is lower in this area than it is overall in Northern Ireland. And if you wanted to make up the shortfall, we would need 12 extra GPs in Fermanagh and Omagh. what was striking is that there are 3 practices that between them have 11,000 patients, but each of them only has 1 permanent member of staff registered. So a retirement here or a resignation there could cause quite a lot of disruption. People in Fermanagh and Omagh are most likely to be admitted to hospital for any reason. They're 10% more likely than the rest of Northern Ireland to be admitted to hospital as an emergency, and 10% more likely to be admitted for any reason. The reason for that isn't clear, but it needs more investigation. About 55% of the admissions to Southwest acute are emergencies, about 10,000 a year, and about 4,000 or a third of Omagh's caseload are emergencies.
Rehabilitation. Cardiac rehabilitation is a good marker of your incident cardiovascular disease rates. And what I found in Fermanagh and Omagh, we are getting 500 referrals a year. So that's 500 patients who've been diagnosed with a heart attack, angina, heart failure. And for the same area in London, one of my boroughs in London is 120,000. We had 200 referrals a year. So I have twice the expected amount here. And why is that? Well, Declan beautifully illustrated earlier the problems. We have a sick population in Northern Ireland, and I don't say that lightly. I thought when I saw the figures I had in my own service, this can't be right. We can't have twice the amount. So I went and looked at the risk factors. Now this is for Northern Ireland as a whole. It's not unique to the Western Trust area. But our smoking prevalence in Northern Ireland is high. Our obesity levels are just, so high. We have a lot of diabetes. We've got very poor dietary habits, and we have that awful level of psychological ill health, which drives unhealthy lifestyles. And it's not just cardiovascular disease. This study made the front headlines in the Times because this third age is the problem. These are people now in their 50s and 60s, and over the next 20 years they're going to age, and we're going to see a tsunami of chronic disease. And actually cardiovascular disease is going to be the least of our problems. What we're looking at is a doubling in cancer rates, a doubling in stroke rates, a trebling of dementia, and a large increase in diabetes.
I'm sure you'll agree that those are very serious and very concerning statistics and health profile of our community in Fermanagh. Of course, those of us who live here will be familiar with that. We know that there are people who are dying because of lung cancer, and we're seeing an increase of that. It's just something that we know. What was very concerning in my experience as an expert by experience was that my constant requests for Dr. Declan Bradley to come down to Fermanagh, sit down with the community and try and work out why the life expectancy of women was falling. Was it because of radon? Because of high levels of unfit housing? Is it an increase in smoking? Is it something that's coming from some of the factories or industries in Fermanagh? Why is this happening? We can't possibly design and review and go ahead with plans for a health plan for this region if we don't know that. But what I didn't know at that time was what the truth was about PID and what the truth was about Pathfinder. The Pathfinder actually had made a decision about our healthcare and our healthcare provision. So I suppose I was unbeknowingly being quite naive about what the plan was for here, and that it had already been pre-decided what they were going to do. I'm still sort of setting this into a context for you, and I hope that you're able to bear with me and watch this, because it's actually quite important that you get this information. I'll be quite relieved that more people know. It's not a very nice place to be at, knowing all this stuff, and you're kind of thinking you'd really prefer other people to know, because we all need to be part of the solution here. I want to explain to you about why we have acute services in Enniskillen, because it's quite important, as you'll see going forward, to know this. About 20 years ago there was a review. It took 5 years to do. It was an independent review. There was an independent team commissioned to decide about where they were going to put acute services in the southwest. At that time it was decided that you couldn't have maintained anaesthetics across the Enniskillen and Omagh site, and an independent body was brought in to look at that. They decided on Enniskillen because every time a service was located in Omagh, over 25,000 people were outside what was the golden hour, which is now the golden 45 minutes. And that's very important. That is a big impact on people in Fermanagh. People often sometimes, from the Western Trust or something like that, people know it comes as far as Enniskillen, but it's almost like the whole west of Fermanagh, and down to Roslea, out to Beleaton, Garrison, even out to Bow, even out to all these areas, down to Belcoo and things like that. It's like sometimes they just don't exist, but they do exist, and people do here exist, and we are, those lives should be equally important no matter where you live in Northern Ireland. So Developing Better Services team said as well that the Omagh Hospital shouldn't undermine the hospital that exists in Enniskillen. But the main point is that the 25,000 people who are so far remote from even an Omagh site, so obviously by far more remote from anything in Belfast or Derry. This part above this line here is an actual slide that was used by the Pathfinder team when they went out all across Fermanagh. Kieran Downey presented this in one of the meetings at Enniskillen, and it said on the slide that Pathfinder is not about, he said it's not cost-cutting exercise, and it's not about predetermined outcomes. So people sat in these meetings all across Fermanagh and were told this, and they were said those claims were wrong. But what they didn't tell you was that around the same time that this all came forward, the Western Trust was in big difficulties financially. They were in debt over 24 million, and the Department of Health was covering it on the basis of a 3-year recovery plan, and that was starting in April this year. And they didn't say any of that. That was not said whenever people were out around the community with Pathfinder. In the Ulster Herald in December 2018, Kieran Downey did an interview, and he said that the future of our hospitals will need to operate as part of a wider network of hospitals, including those across the border. Okay? Now, we weren't quite sure what that meant at the time. Obviously, hospitals are always part of networks. That's normal. But that became more telling as more information arrived. But that it also said that the trust plans had the backing of all the North's political parties. Now, what the political parties did back was Bengoa and the Health and Wellbeing Report. But beyond that, how they were played out, how they were interpreted, or how they were used were not backed by the political parties, because none of the political parties know that, and none of the political parties have actually been in power since all of this started to roll out. The project initiation document is PID, the PID, they hid. This is a document that I've been asking for. We applied for these appointments in January, and it wasn't until the 8th of May until that was actually made available, on the same day that they asked us to sign what became known as the gagging order in the press. The PID that they hid said that there was ongoing viability questions about the South West Acute Hospital. That there were challenges to the healthcare economies. That's about money. So specific challenges in delivering acute services. There were isolated location because of the high cost of locum coverage. Now, I have to go back slightly here, because after they had Bengoa and the Health and Wellbeing, they established, they put out for consultation a criteria for reconfiguring services. And that was put out by a group called the Transformation Implementation Group. that we're basically there to implement, you know, those particular reports and that particular change. But it is just a group of civil servants effectively coming together and making decisions with no governance in place that's appropriate in a democracy at this time, because we have no functioning stormont. So there isn't the oversight that we would like to see. They said we were too reliant on high-cost locum cover, and that led to problems with sustainability. And said it could be non-viable at extremely short notice. But more importantly, and these are the telling lines, that it said that the purpose was to remove the Trust's dependence on locums in the South West Acute Hospital. Now it doesn't say try to resolve it, it doesn't say try and lessen it, it says remove it. And that is a decision. So that's not something that's like, you know, we have a problem, we'll move to co-production, which we talked about at the beginning, and we'll try and be open and honest with people, we'll be transparent with people, and we'll try and solve the problem. This is a decision, and that's in writing in the project initiation document, which is the terms of reference for Pathfinder. This is page 10 of that document. This is where it's laid it out, what specific challenges in delivering health acute care, talks about service being reliant on the locum cover, talks about sustainability, non-viability, and there it is, you can see for yourself on the document, remove the trust dependency on the availability of locums. And we're talking about putting in new models of care to do that. Now, you'll see in a little while, we'll talk a little bit more about that in a minute. It says, actually, at the beginning of that document, it talks about the acute in the local hospital, the acute hospital in Enniskillen, and the local hospital in Omagh, but further on in the same document, it talks about local hospitals. It says that regional support will enable change, and that partner organisations will provide the capacity. These are all judgments, these are all decisions, there is no co-production in this, and there is no governance in, appropriate governance in, or no democratic governance in this decision. The PID says that the problems in acute are symptomatic of the need for change in local health care. Now, we will see that further on that that's maybe, you know, contradicted to other independent reports. We feel that the problems in our acute care in the South West are symptomatic of the Western Trust poor management. Failures to implement all the content of the workforce strategy, World Health Organization recommendations that were put in place for maintaining acute services in more remote areas, and their failure to co-produce solutions, and you know, for SWAH. You know, decisions are being made that are there to take the locums out of SWAH, and there is no two ways about it in the Pathfinder. So the priority of Pathfinder is actually about cost saving because of the high cost of locum cover, and it's not about appropriate access for people to hospital care. In truth, there was 5 years of independent review that said we needed acute care in the South West at Enniskillen. In truth, there was 700 million, that's cost and interest and everything like that, 350 million initially for the build of the South West Acute Hospital. But massive amount of money spent on that new hospital that's not that long open, probably about 7 or 8 years, and saying that we need acute care in the South West. Those are two big pieces of work and big pieces of expenditure that said, yes, these people need to have equity and equality of care and appropriate timely care in this area. The golden 45 minutes, used to be the golden hour, also says we need to have acute care in the South West. Now, let's be clear here on what acute care. Acute care is your A&E, your surgical, your medicine, your maternity, your neonatal, your paediatric, and all of these things that are so important because of the time of getting there. You know, if you have an accident or an emergency or there's having a baby, you can't think about going to Omagh or Derry. And those are very important services that are needed within a unique time frame. But we have management issues in the Southwest Acute Hospital. We have many reports of bullying in the Southwest Acute Hospital. We have never had an appropriate effort to develop the Southwest Acute Hospital as it was supposed to have been developed, even in reference to the Developing Better Services report that decided to put it there, which incidentally has been removed from the Department of Health website and can't be found, except I happen to have a copy of that report. There's been no effort to retain staff. They don't conduct exit interviews when somebody leaves, and there's no planning appropriately for when somebody is going to retire. That's just a little tiny snapshot of some of the issues that we're aware of in the Southwest Acute Hospital that are part of the management issues that we're aware of, that are impacting services and provision. We're not saying that, that we're immune from the need for locums. Every hospital across Northern Ireland and every service across Northern Ireland is in some level dependent on locums. The whole of the UK is. It's got to do with something called the European Working Time Directive and other issues like that cause these issues with dependency on locum. And naturally, whenever you're a little bit more rural, those problems are a little bit more acute. That's only to be expected. But that doesn't mean that we should be without them. We feel that bad management has left the staff feeling down, apathy and hopeless, and that's been reported to us many times. There is a decision here to save Omagh and put the debt and the costs of having to travel elsewhere onto the community in Fermanagh. All of the losses and the costs put onto the community in Fermanagh are there to allow Omagh to be sustainable and secure. And that there's no guarantee for any of these new models as we'll discuss in a moment. The hospital staff who we've spoken to about this document and these plans said that it is absolutely not possible to remove locums from Enniskillen and the Southwest Acute Hospital and still have A&E, surgery, general medicine, maternity, etc. in the Southwest Acute Hospital. Locums are enabling most services in the SWAH, and this is, I say, also true for many services in the Northern Ireland and the UK. And of course, yes, more rural areas are normally more dependent, that's only natural. The hospital staff also tell us that, and this is consultants in the hospital who must remain nameless because of the way that the Western Trust manage staff, the new models and alternative pathways to remove the need for acute care have A&E and etc. like that have been tried and have failed in England. The UK government trends are, and this is something that the staff are aware of, that they use a difficulty with recruitment as a facade to present to the community when they say that when there has been a management or political decision to close services in the Southwest. So that's very important to know that, because they're hiring PR companies. The Department of Health have just hired the PR guy who used to work for the Nolan Show, and the Pathfinder's first move was put a PR guy in place. So they're getting very clever about how they present information, how they withhold certain information, and how they communicate to people. And so people are supposed to sort of accept, well, we can't recruit. Well, we're telling you that there are documents that prove that there's an awful lot more that could be done, that should be done, that hasn't been done, and that needs to be done. And we're asking you not to believe that, and certainly not an appropriate plan for our acute services. In reality, the Trust failed to develop the service at SWAH, and there was need for a regional plan, even a cross-border plan, and more plans to sort of think about needs and what could happen and where it could happen, that didn't happen. So we're aware of that as well. The workforce strategy for 2026 and the World Health Organization recommendations were not implemented. Again, there was another process about recruiting and retaining that was organised by COT, Cooperation and Working Together, that also wasn't implemented. So the situation needs investigation and the situation needs co-production. It does not need decision taken by civil servants to remove locums from SWAH. And we feel very strongly that the Pathfinder process as it is at the moment needs to stop. It cannot be changed. It cannot be made okay. It can't be altered because of that predetermined outcome to remove locums and send people off to regional capacity elsewhere, and that reference to local hospitals. That's a plan. That's not nothing to do with co-production or taking things into account appropriately. What we need now, we're saying that there is an urgent need for an external, independent investigation into the Western Trust's management of the South West Acute Hospital. We need to understand why there are so many difficulties in that hospital. We want to see better co-production, we want to see openness, we want to see transparency. We need the staff to speak openly and honestly to somebody independent and to find out the truth about what's been happening there and what they feel needs to happen. And when the community needs to know that. This is our health care, this is our hospital services. We've paid for this through all our taxes and everything, and it's very important that openness and transparency and the truth comes out as soon as possible. Pathfinder is a judgment by the Western Trust and the department, and we feel that the same management that have got us into this difficulty and are causing these problems and are overspending management is not the same management that can get us out of this. So we need a fresh look at the whole situation. There's a long established pattern to disposing of assets and disposing of services and things like that, and it is to make it look like it doesn't work, run it down, say it can't be saved, and to make the whole situation look hopeless and unsustainable and everything else like that, when it's actually a decision, and it's very clear in this situation, this is a decision. The independent expert reports are needed in this situation to look at the whole situation, with regard to the community and the community needs and our profile here and the situation with our hospital. And there needs to be an appropriate recruitment plan, management plan, and more importantly, and most importantly, the development plan for SWAH, to fit, into a configuration for it to become a sustainable future, not just to be written off as unsustainable and could be non-viable at very short notice, as the PID says. We need to get that sustainable future put in place. And those independent experts and that independent report, we feel, needs to be mutually agreed. There is the old saying, whoever pays the piper plays the tune. And we need to make sure that we get independent experts that come in that are mutually agreed. And there has to be that listening to staff. They're on the cutting edge here, they know the service, they know the issues, they know the challenges, and they're a vested interest. They live in our community, they're part of our community, and they will be part of the solution here. The World Health Organization recommendations on recruitment are there. There are many and varied and wonderful ideas and everything. Recruit and retain, recruit and retain, solving regional issues, training and implementation of the workforce strategy that has lists and pages and pages and pages of all the things that need to be done to address the situation with locums and everything. To ensure that there is equity, accessibility and fairness in provision for this area. And those are very important things because when they went through the criteria for transformation and reconfiguration of services, they actually said that these should be considered, but within the PID and within the current plan, there is no consideration for equity, accessibility and fairness in these plans. We need a profile of Fermanagh's unique needs. We need a health profile of this community. We need to urgently understand why women's life expectancy is falling year on year for the last 4 years for women. We need to quantify the current burden and costs onto us as a community, and the costs of this plan to find paths out. When they're talking about Pathfinder, the paths out are to out, or from Omagh to other regional capacity. And we need to look at what the actual impacts are, measure the impacts on our community of the proposals of Pathfinder to take no locums out and leave us without acute care, because acute care is dependent on locums. So those things all need to be done. We're not alone in knowing what should happen here, and the staff are right in what they're saying, and that's confirmed by an independent body called the King's Fund. They're independent health analysis. They do conduct studies that are independent, and that's very important, that independence, because it takes out the agenda of the Western Trust being short of money and looking after Omagh or Belfast or another area like that over and above us. This is independent experts, and these are people that we can look to for input on this. And they're very clear in what they're saying, that there is no evidence to suggest that reconfiguration, including moving to a more community-based model of care, will deliver significant significant savings. And you can't remove, and that's what the consultants are telling us, and that's what the King's Fund is saying. So they may say that, oh well, we maybe just need a local hospital. We could do with something like Omagh has at the moment, and we could do with maybe a couple of health hubs out in the west or things like that. That we'll just, we don't really need acute care. We just need these little, little bits of care at GP or health centre level. But there is no evidence that that's going to remove our need for A&E or maternity or anything like that in this area. That's just, we feel that's absolute nonsense. And it's just purely a cost-saving exercise, because our trust are 24 million in debt, and we're part of the plan to pay that off. The independent report says that there needs to be a benefit between access, something that's not mentioned at all in the Pathfinder document, between access, workforce, quality, finance and technology, that will play out differently for patients with different levels of clinical risk and complexity. And this is another very concerning thing about the Pathfinder, is that the decision was made in Pathfinder to take the locums out of SWAH before they had even conducted the health analysis or collected the health data, before even Dr. Declan Bradley had even finished his work to actually define why women's life expectancy was falling here, why our cancer rates are up, for some cancers up 60%, and why our suicide rate was double. We are paying a price here, and it's showing up and emerging in the trends in our healthcare, and that has got to be understood. And it's ridiculous to be putting in a judgment and a solution to say take the locums out of SWAH before that clinical risk and that clinical complexity, was actually even understood, which is so concerning about Pathfinder, because it ditched completely the idea of co-production and working together, and community and staff empowerment and decision makings. But it was vital to consider clinical codependency. It's very important that we understand our hospital services fall like dominoes. They're all interdependent. You can't have, you've got 24-hour anaesthetics, you've got to have this to support that, you've got to have surgery to support A&E, you've got to have maternity, they need surgery, they need anaesthetics, everything's codependent, and we've got to understand that we must hold these services in this area. It said in this independent report that it was time to challenge the biggest and best. The UK are a bit further ahead than we are here. They're actually, have been there and done that and tried what's been pushed forward now in Northern Ireland. That configuring everything up to Belfast or Derry is not necessarily the best solution, because it actually says that it presents a danger for rural communities, and that's what we're experiencing here. And we here in the west of the locks, as we say, in Fermanagh, are going to be the ones on the cutting edge of that. talks specifically about distance decay, and it actually is able to quantify that. The studies have shown that it's a 1% increase in mortality for each 10-kilometre distance. Now, you who are good at maths might be able to work that out. It says that A&E, acute medical, acute surgical, stroke, that it says really needs to be dealt with within an hour. Maternity, neonatal, paediatric, all of these ones, they're all reflecting a distance decay between 1 to 1.07%. I think that's particularly with regard to, if my memory serves me right, it's to do with paediatrics and if a child's having an asthma attack. But it's that increase in mortality for every 10-kilometre distance. And if you're talking about 100 kilometres between Enniskillen to Derry, or Belfast, you're talking really about a 10% increase in mortality, and obviously longer from Beneath or Rosslea, but there are better statisticians in the county than I. So, but that figure, that distance decay figure, is the truth, and that's the reality. It's not being considered in this. What we feel needs to happen now, very much we feel like we're very, very vulnerable because we do not have a health minister, we do not have a health committee, because we have no government. And that's putting us in the most vulnerable community and probably the most vulnerable position. In this regard, I feel that there's a real need for legal advice, that we need to be looking at the Rural Needs Act, we need to be making sure that works for us. We need to be looking particularly at equality impacts. Whenever you see the women's life expectancy for women falling year on year from 83 to 79 for the last 4 years, and that's a trend that absolutely has to stop urgently, and we have to understand that urgently. We have to understand why women are dying early here as well. We need Dr. Declan Bradley to come down and work open and honestly and freely with the community, and we need to understand that questions over the 60% rise in some cancers, over the last 5 years. We have to understand these issues, because if we don't understand them, then we can't address them. We need complaints urgently to the Trust, because they have to go to the Trust first before they can go to the Ombudsman and the Equality Commission. We feel that, and it's our belief that there is a neglect of duty in the civil servants, and their failure to consider the impacts on our community, our failure to understand our needs. We need to lobby our MLAs to get back to work. It's a very serious situation to be in the most vulnerable community probably in the UK, and at threat of losing our acute services, which are our A&E and all our urgently needed services in the area. We need a health minister and we need a health committee. Democracy really needs to function here. The civil servants in Belfast and Derry are living in a little bubble, looking at particular facts and figures and pounds and pence and things like that, but they're very separate from our reality. So we're not having the right representation in that. We don't even have somebody from the Western Trust who's actually from Fermanagh. We don't have any representation. There's no democracy or things working at the moment. So MLA's getting back to work, and a functioning health minister and a functioning health committee taking charge of this process is urgent. Councillors, we really need to do everything possible to actually stop Pathfinder and call for this independent investigation into what's actually happening, and make it an open and transparent process that really empowers staff and empowers the community appropriately, that everybody's part of the solution here. There's 24 million in debt. It's a problem that belongs right across the Western Trust. It's a ridiculous thing to say we're going to have a Pathfinder process and we're just going to make it about in and around the Southwest Acute Hospital. There's 24 million in debt. That needs to look at the whole issues right across the Western Trust, and that's going to require a lot of openness and transparency and honest conversations. Pathfinder is a decision. it's not something that they're saying, well, we've got a difficulty, how shall we solve this together, what's the best way forward, and not making us part of that process. We need to be also part of the recruit and retain plan. There's lots of things our community could do, lots of things that should be happening that are not happening. These are our nurses and our doctors coming to work in our community. The trust have got to stop this wall that they're building between the nurses and doctors in our hospital and the community. It's a wall of silence, and it's a keeping separate that isn't appropriate. These are people that are very valued, like everybody's valued in our community, but we need to especially to be taking really good care of those who are coming to take care of us. And that's very important. The Western Trust withheld the truth about this process. Certainly even from myself as somebody who was appointed as an expert of experience into it. It's a ridiculous thing not to have been giving that information about the truth about the process, even when people were encouraged to apply for those positions. Certainly at even the time when they were appointed, even when they were in the role, and the biographies and the images and everything like that and photographs were being used as promotional material and around that health summit and everything else like that. All of that time, the truth about Pathfinder was hidden because they hid this project initiation document. The health profile of the community, which was put up on this massive screen in the Ardoan, was hidden from the community. This information was not given out and not shared appropriately at the Pathfinder meetings, and the truth wasn't shared with the community at those Pathfinder meetings. They have imposed gagging orders on the community representatives. When you tell them that the information shared with you as part of your role can't be shared with the community, it's not appropriate, because what Pathfinder is doing is influencing and shaping community health. There's no reason why there should not be full openness and transparency around that. There's been no co-production, which our whole presentation explained that. It was what Bengoa had set up. It was very important. It's a very healthy way of working. It is not the traditional way of working in the Western Trust or the Department of Health. Not the traditional. It's what Bengoa said should change. And it's a very positive change and a different way of managing, of empowering the staff and empowering the community. And those things are very positive, important ways of working. It is not happening and has not happened in any way, shape or form so far with Pathfinder. There is no governance. This strategic group is only coming into play now. While that whole process has been shaped, while that whole process has been designed, and all of those things have happened, that whole engagement things happened, that whole PR event happened. We actually, as an expert by experience, actually asked to speak at that event to represent the particular needs in the community, and was refused to do so. There's no independent oversight in anything that's happening at the moment either. So the implementation plan is coming about now, before anything of that's in place, and there are serious impacts on our community, and it affects us both our health and it affects us financially, not just about the cost which potentially transfer onto the community, because we're having to suffer all that if the services move out, but also because every time you take a service out of an area like that, and especially if you're going to remove acute services, financially and economically, in terms of people trying to make a decision to come and base here and set up here, it does go against economic development in the area. What we feel we need next is definitely we need a team that is the best in Fermanagh. This is one of the most serious issues that Fermanagh has ever faced ever since there was a review of hospital services 20 years ago. We really need funding for legal and professional fees, and we need to consider about how we're going to do that, whether we set up a crowdfunder, whether the council can find some funds to be able to try and get some of that started, or what way that's going to work, it needs to be discussed. The staff in SWAH need to speak out. There's a whistleblowing policy that says, if something's in the public interest, or there's other things like that, there are clauses in the whistleblowing policy, and we would encourage the staff to speak out and help us to save the services there. and to find a way around that. And the trust really needs to allow that open, honest conversation. We need the council to understand what is going wrong, what should be happening, and we need their help to stop the Pathfinder process. Simply because when something has made a decision like this, and it's an inappropriate decision, then you can't make that right at all. The existing experts, by experience, of course everybody's up to themselves what they do, but we would think that it is not appropriate for them to be supporting something that has a clear decision to take acute care out by taking the Locums out of the hospital in Enniskillen and effectively making it into a local hospital. We need the community groups in Fermanagh to meet regularly, and that's very important that representation from each community group starts coming together so that there's a network, and we need to get a much stronger community here and a much stronger base in this county so that people can get informed and get active. This is a slide from the presentation that was done at a public meeting, so there was at this stage a discussion, but also a link to finding out more where people can see the PID document itself, and they find the link to that from a Facebook page called Fermanagh Community Pathfinder Resource, just really to be able to make information accessible and documents accessible to everybody. So that's the presentation that I was asked to make for everybody. Thank you very much if you've watched it all the way through. I hope you agree it's very important information. As I say, knowledge is power. We really need to get strong. We are a really vulnerable community here, especially where this has been recorded. You're out west in the west of Fermanagh, and let's get informed and let's get active and let's get this thing sorted out. Thank you very much for watching.